Welcome, everybody. Once again, to our first annual Older Coloradans Month, which is our version of Older Americans Month, which happens every May. And every May, there's a theme. And this year's theme is Communities of Strength. So our webinar series actually builds on that theme. Our team, composed of Colorado Senior Lobby, Colorado Center for Aging, Changing the Narrative, AARP Colorado, Lifelong Colorado, and DrCOG, is exploring with you the common interests and strengths of all Coloradans, in particular the 2 million of us over the age of 50. For some of us, age 50 is a long time ago. For others, it awaits in the future. The primary purpose of this three webinar series is to inform and encourage each of you to engage with us, to raise our voices, and to be really heard with our policymakers at every level of government, and to create new communities of strength. Today's session focuses on age-friendly communities and what that means to us here in Colorado. And in our final session, we'll hear from people all around the state and what they are doing to facilitate the process of aging in their communities. So be sure to tune in for that one as well. You may have seen the revolving PowerPoint. You're seeing it right now, except it's not revolving, with our sponsors, and we thank each of them for their support. Relay Colorado, InnovAge, Colorado University's Multidisciplinary Center on Aging, and Primetime News. So I'm now going to introduce to you Katie Bishop, Relay Colorado, who will tell us a bit about how that organization works and how it helps the hearing impaired. And then after that, we'll dive into today's presentation. So Katie, please introduce yourself, and I'll stop this thing and we'll start the other. Thank you.
Sure, thank you for having me. Relay Colorado is honored to be able to sponsor your event. And my name is Katie Bishop, and I am an outreach specialist with Relay Colorado. So we just want to share a little bit about who we are and what we do.
Okay.
Okay, here we go. So what is Relay Colorado? As you can see, it's a partnership between the Colorado Department of Regulatory Agencies, and we have a contract that we are held with T-Mobile Accessibility. So Relay Colorado, it's a statewide service that connects standard telephone users with deaf, hard of hearing, deaf, blind, speech disabled, or late deafened people who use the teletypewriter or voice carryover phones. Then the conversations are relayed between two parties by a specially trained communications assistant. Our services are offered 24 hours a day, 365 days a year, and it is at no cost to the consumers who live or work in Colorado. Relay Colorado is a service that is provided by the Colorado Public Utilities Commission. So it's contracted, again, like I said, with T-Mobile Accessibility, and Relay Colorado is funded by a surcharge that's established by the PUC. So a couple of our services that we have available are pictured here. And again, it's at no cost to individuals who live or work in Colorado. And to learn more about our services, please do visit our website. We have a lot more information there. One of our services that we offer to stay connected through telephone access and other services is our CapTel phone. CapTel stands for Caption Telephone. I'm not sure if you've seen the captions on TV. It's a similar concept, and it's used through the phone. So the CapTel users will hear what they can hear and read what they miss. Again, it's a no-cost service, and it helps reconnect individuals to friends and loved ones and gives them that independence that some individuals have lost due to their hearing loss. CapTel phones are not for, CapTel phones are for anybody who has a hearing loss. standard phones don't have that higher decibel level. So the special CapTel phone is able to add clarity to the conversation. So many hard of hearing individuals become withdrawn from society or family gatherings because it's difficult to hear multiple conversations that happen at once. So they'll ask others to make a phone call for them, or maybe they'll stop making phone calls entirely. So they may ask, what, or can you repeat that? And many will begin kind of nodding in agreement whether they understand or not. So CapTel services allow individuals to stay connected and have their independence. Relay Colorado offers webinars, so please visit our website for more information and or to register. They are offered monthly and they are at no cost to individuals who join. You might be advocating for somebody who has a hearing loss or a speech need, and or somebody who is working in the agency with you, or directly a person who has a hearing loss themselves can sign up for the webinars to learn more about our services. We do also have access with interpreters and our relay conference captioning, which can caption your conference calls as well. So anybody who lives and works in Colorado, these services are offered at no cost to them. Thank you so much.
Well, thank you, Katie. And this is a very important program. I remember my own father, and he kind of just tuned out of the world because of his hearing loss for the last several years of his life. So it's good to see that something like this is available and at no cost to the consumer.
Yes, for sure.
Okay, thanks again. And now I'd like to introduce Kelly Roberts, who is a VP of Colorado Senior Lobby, and she's going to be our moderator today. So Kelly, take it away.
Thanks, Bob. Well, for today's webinar, we are extremely fortunate to have the presenters that we do, because all four of them are driving forces with programs for helping communities become age-friendly or become more age-friendly. And I will tell you that whether you know nothing, maybe something, or a lot about age-friendly communities, I think what they're going to share with you and their program will have something for everyone. So they are driving today's program. I'm going to turn my camera off and enjoy the show once they start presenting, but they're going to present some information. Then we have a polling activity, and then some facilitated conversations that they will coordinate. So I'd like to introduce our driving forces. We have Jared Hughes, who is with the governor's office and where Lifelong Colorado is housed. We have Bob Murphy, State Director of AARP, and Roberto Ray, Associate State Director with AARP, and they'll be talking about their Age-Friendly Colorado program. And then we have Derek Webb, who is a planner with the Denver Regional Council of Governments, where there is an age-friendly program called Boomer Bond. So you're going to hear about all of these programs. So without further ado, I'd like to turn this over to Jared Hughes.
Well, thanks, Kelly. I think Bob and Roberto, I will let you take it.
Thank you, Jarrett and Kelly, and welcome everyone. Good afternoon. Thanks for joining us today, and hopefully this will be an informative and even entertaining session for you. And we're going to leave plenty of time for questions and answers, including some polling questions later on. So again, I'm Bob Murphy. I'm the State Director for AARP Colorado, and Roberto Ray is also joining us, particularly for the question and answer session. All the hard ones will go to Roberto, who does a lot of the on-the-ground work in our age-friendly communities. Next slide, please. So most people know about AARP. They know that we're a large nonprofit, nonpartisan membership organization. We do have nearly 700,000 members in Colorado. Most people know about our advocacy at the federal and state levels. Not so many know about our advocacy at the local level, where we are often talking to city staffs and county commissioners and city councils about local issues, affordable housing, mobility, transportation, zoning, that sort of thing. Most people know about our advocacy on healthcare and Social Security and Medicare and lowering prescription drug prices. We certainly have been active for the last year and a quarter with the COVID-19 pandemic. Certainly trying to let folks know about the unfortunate situation in our nursing homes nationwide, and then encouraging people to get vaccines and telling people how to be vaccinated. We support family caregivers. There are over 40 million in the country and over 600,000 family caregivers here in Colorado. Other priorities of ours are the 50+ workforce, including fighting age discrimination, acknowledging and trying to leap the digital divide by providing older adults with devices, training them how to use devices, and also supporting broadband so that they can use electronic devices and the internet. And of course, encouraging people to save for retirement. But what most people don't know is what we're going to talk about for just the next few minutes, and that's our work in age-friendly or livable communities. Next slide, please. So 1 out of 3 Americans is age 50 or older. By 2030, 1 out of every 5 people in the United States will be 65 or older. And our AARP Livable Communities work is based on that fact and that question: will your community be ready? Next slide, please. AARP's network of age-friendly communities began, this work began around 2013, and we now have not quite 540 members. We're close to 530 members across the country, including 6 states and 1 territory. The 6 states that are members of the network include Colorado, which was the 3rd state to join back in 2018 when Governor Hickenlooper declared Colorado to be an age-friendly state. So it is a rapidly expanding network. Next slide, please. So we have currently 19 members in Colorado, including the state. And this is a slide with a lot of fine print, but the point I wanted to make with this slide was that on our website, on our AARP Livable Communities website, there is a lot of information, but it includes very specific information about our age-friendly community members in Colorado, including their application letters, and in many cases, their age-friendly community action plans. So it is a great local reference for folks to look at if they are considering embarking on age-friendly or livable work. Next slide, please. I talked about the Governor Hickenlooper declaring Colorado to be an age-friendly state in September of 2018. His vision of an age-friendly state was really one that is composed of as many age-friendly communities as possible and supported by pertinent agencies at state government. And the entity that was created at that time was called Lifelong Colorado, about which you will hear much more from Jarrett Hughes from the governor's office shortly. Next slide, please. So the framework, what we do is we provide the framework for communities to begin their age-friendly work. The domains, as we call them, are listed there. There's a slide. In fact, let's go to the next slide. It's a little bit easier to read. So we start with 8 domains of livability. Housing, transportation are certainly always top of mind when we talk about challenges and barriers and obstacles for older adults, but certainly respect and social inclusion, social participation, work, back to that workforce issue and civic engagement, communication, health services, obviously, and of course, outdoor spaces and buildings, which implies zoning and lots of other things. These 8 domains are extremely flexible. If a community is interested in beginning this work, they can choose 3 or 4 or 5 of those domains, and they can add something that's very important to their community. It could be an environmental related issue. It could be mental health. It could be one of anything that's important to the community. Underlying this program is the theme of flexibility. We have nearly 530 members throughout the nation, and I'm sure we have nearly 530 unique models for approaching the local work, and we support that. Next slide, please. We support it via many, many resources and publications. And I would encourage anyone that's interested in this work to begin by going on our website, aarp.org/livable communities. And you'll just begin to see everything that's available. We have publications about improving neighborhoods, the ABCs of ADUs, which of course are accessory dwelling units, creating parks and public spaces. We also put a great emphasis on rural work. Rural Livability Workshop Report is one of those publications. And indeed, several of our members here in Colorado are smaller rural communities. I think of Las Animas and La Junta and Fruta, amongst many others. In fact, Logan County just joined this year, as did Chaffee County. Next slide, please. We also have a new series of videos that debuted earlier this year. It is a 6-part series, about 75 minutes long. That is a tremendous resource for anybody just kind of starting this journey and wondering what it's about and wondering if it's something that they would like to get started in. Again, available on the website, or certainly email Roberto or myself, and we will get you these links. Next, please. Again, we try to support communities that want to get started, and you know, what is that first step? I mean, how do you get out of the starting blocks? And that's something that we spend a lot of time and have a number of resources to help communities with. So we have an introductory booklet. We have a booklet on what we call the program cycle to explain the process and sort of the series of 5-year plans that are involved. Next slide, please. And we have books like Creating a Community Action Plan, Making Plans, Taking Action. Next slide, please. So I think this is the last slide, and I want to try to answer the ultimate question of why should you pursue age-friendly work. Again, those statistics about how America and indeed Colorado is aging, but the underlying foundation of this is twofold. Number one, 75% of residents surveyed say they want to age in the community that they call home, right? They want to age in place. And in fact, that number rises to 85% in Colorado. I mean, why not? Look where we live. And the other underlying principle is that when policymakers and stakeholders get together and plan their community's future through that age-friendly lens, the result is a community that is friendly to people of all ages. So I think that's it. And we will take questions later. Roberto and I will.
Thanks, Bob. And hi, everyone. I appreciate the opportunity to be here today. Jarrett Hughes, I'm the policy advisor focusing on aging and older adult issues with Governor Polis's office. I want to put a couple links in the chat before I kind of dive in. So the first link I've put in is to a Google form that will put you on my email list. If you'd like to be on kind of the general distribution list with emails I send out, I often try to send out various updates from the office related to this work, as well as, for example, our Governor's Commission on Community Service, Serve Colorado, is doing a statewide needs assessment right now to kind of direct volunteerism activities through Serve Colorado and AmeriCorps. So for example, that's one thing that I'll be kind of sending out a reminder email around. There's about a week left on that. So if you'd like to get those emails, feel free to register. If you start getting them and you would like to be removed, you can just reach out to me and let me know, and I can take you off. I try not to send out too much because we all get plenty of emails. I know that. Then the next thing that I wanted to share is a link to our Lifelong Colorado State Plan. This is something that I am proud to have had the opportunity to work on and put together. And it really is kind of a synthesis of a lot of the work that the Strategic Action Planning Group on Aging has done, as well as the Colorado Commission on Aging prior to that. So I will put this link in there now, and that will take you to a PDF version of that document. You can take a look. You can provide feedback. We have a steering committee that, for example, Bob and Roberto sit on, as well as Derek, who will be talking after me. So there's a handful of stakeholders that make up that group, including State Department representatives and individuals from community-based organizations. So we are open to feedback. This is a living document that is really supposed to be kind of updated and modified as we kind of move along this journey. So again, as Bob really indicated, I mean, this Lifelong Colorado idea, this initiative was really cultivated and came to fruition under Governor Hickenlooper and by one of my predecessors in this position, Wade Buchanan. I think all of us, and I will be the first to admit that we have hit our fair share of roadblocks along the way since kind of conceptualizing and launching this work. The pandemic obviously uprooted everything and caused a significant pivoting in resources and focus and attention. And as we kind of exit out of the crisis stage of COVID-19 and can kind of return to, somewhat of this new normal that we have, one of my top priorities has really been kind of picking up Lifelong Colorado and re-energizing it and mobilizing this effort as we move forward. As Bob also indicated, these 8 domains of livability are really what promote healthy, equitable, and livable communities. And they require policy systems and environmental approaches that work outside of our traditional partnerships. For example, public health research increasingly indicates that an individual zip code is more closely correlated to health outcomes than genetics. So, we talk about these social determinants of health, and social determinants of health are very closely tied to these 8 domains of livability. These are broad factors that impact us across the lifespan, and they influence outcomes in later life. One of the things I'm often telling folks in the office and folks that I work with is that, aging doesn't occur in a vacuum. It's environmental, it is our surroundings, it's social context. So to kind of influence and take into consideration where we live and how we live, that impacts our lifespan and our life course and our outcomes. Again, addressing these factors requires really kind of thinking outside of the box in some regards. Cross-agency partnerships at the state level, and then effective collaborative partnerships at the local level are necessary to move this work forward. And those non-traditional partnerships are incredibly important in moving this work forward. I think we often have excellent coordination and communication, for example, with our area agencies on aging or our human service providers and our transportation providers and our faith-based communities. But, there are partnerships and opportunities for engagement outside of those typical groups that I think are very important to move this work forward. I know I'm not looking at the participant list right now, but I know at this last week's Strategic Action Planning Group on Aging meeting, there was a great presentation from Jefferson County and Karen Stewart and Rachel Cohen doing some work there. And they really highlighted the importance of that non-traditional partnership focus is engaging in this work. At the state level, this work is very much closely aligned with the Department of Local Affairs and the Division of Local Government, more specifically the Community Development Office. But with that being said, I have been very intentional and proactive about bringing in folks from the Department of Healthcare Policy and Financing, as well as the Department of Public Health, the Department of Human Services, and working on integrating the Department of Transportation into a lot of these discussions. And so I'll talk a little bit about this more later, but that sounds very state heavy, and I just kind of want to acknowledge that head on, and that this is very much the approach and the vehicle that we are using to kind of do this aging related work in Colorado, but without local support and local leaders and community-based organizations really taking that last mile and that final step. What we do in statute or what we do in state constitution or what we do in rules does not matter that much. So it really is kind of this top-down, bottom-up approach. And I think that's part of the beauty in kind of conceptualizing age-friendly and livable communities and lifelong Colorado. I put this slide in here to just kind of highlight a little bit around some of those non-traditional partners. And I think, I have taken very much a strong focus on community health planning and multi-generational planning. And, getting back to that kind of alignment with the Community Development Office and the Department of Local Affairs. And Derek will certainly be able to share a very good perspective and detail through this perspective. But for example, the American Planning Association at the national level has recognized that the aging of the population creates a unique opportunity and responsibility to apply proactive planning approaches and policy to improve communities to address the spectrum of needs and abilities of the folks that live there. So, the American Planning Association has been very clear in their support for the creation and integration of housing, land use, transportation, economic and social service and health systems that support a high quality of life across the lifespan. This multi-generational planning approach ensures that the needs of all residents, whether 8 or 80, are met and planned for and don't come as a surprise. And that allows us to be less reactive in our policy and more proactive. And, talking about those non-traditional partners, again, a very important piece of the puzzle. And, one thing that the American Planning Association did a few years back was a joint call to action to promote healthy communities. And they brought together 8 national organizations that we often wouldn't think of as players in this space. And that includes the American Institute of Architects, the American Public Health Association, the American Society of Civil Engineers, the American Society of Landscape Architects, as well as the National Recreation and Parks Association, the U.S. Green Building Council, and the Urban Land Institute. So again, I just really kind of share that to kind of emphasize that there are non-traditional partners in this space that can really kind of impact what happens at our municipal and county levels. We as a state spend, around $2 billion annually. That includes state and federal dollars on a wide range of programs and services that fall within kind of this domain of aging. And that spans Medicaid, our area agencies on aging, financial assistance with old age pension, senior property tax exemption, as well as adult protective services and protections against exploitation and fraud. Taken together, these programs have not necessarily reflected a clear strategy or set of priorities. As is often the case in policy, it's reactive, right? Something happens, the legislature responds, or an administration responds, versus really kind of taking a forward-looking longitudinal lens to this work. So, from my perspective and from our perspective, Lifelong Colorado and the associated livable communities work represent the foundation for an intentional and coordinated strategy in the face of Colorado's shifting demographics. So, these efforts are ultimately based on the idea that effective and sustainable solutions have to include local coordination and involvement. So that's not to say that state level involvement, or I guess what I'm trying to say is that's not to say that it's all up to the cities and counties, right? State level engagement is critical piece of this puzzle. And if you read kind of the literature around age-friendly livable communities, there's often reference to this backbone organization that can really provide direction, technical assistance, and organizational support to these community-based efforts. So it really is kind of this dynamic, interdependent work with the states and local governments, as well as individuals and community-based organizations at those local levels that really can effectively move this work forward and impact local planning and implementation within these 8 domains of livability. I've included this. This is actually just a screenshot of one of the matrix that is included in the Lifelong Colorado plan. So again, I really kind of, prior to this work in the governor's office, I had the great chance and opportunity to work with the Strategic Action Planning Group on Aging. And so much of this work that is integrated into this Lifelong Colorado plan would not be possible without the work that was done by the planning group. So, for those of you who are familiar with that, as you look through this matrix and kind of look through that language, you will see common themes, common strategies, and common steps. And again, I think just to kind of indicate, I really do kind of conceptualize this as our baseline as we move forward. This is kind of the foundation that I expect to be able to kind of stand upon to hold and lift this work up and move forward. This is just really a small list. I mean, there's no way to include everyone that should be a key partner in this work in one slide. But the point here is to really indicate that it is not just one entity. It's not just me in the governor's office. It's not just AARP and Bob and Roberto and the great work that they do. It's not just DrCOG and the Boomer Bond assessment. It really has to be kind of a coalition of folks. And we have to really kind of come together to really move this work forward. Again, I think I'm really happy that we've submitted this Lifelong Colorado State Plan, and it's been approved by Governor Polis and Lieutenant Governor Diane Primavera. It's been approved by AARP National Office, and we received our approval certification from them actually yesterday morning. And so, kind of my next steps, at least internally and for this work, really involve around completing a best practices report in coordination with the Community Development Office at the Department of Local Affairs. And then, really kind of turning towards some training opportunities and webinars focused on livable community planning and how cities and counties can become engaged and start on this work. And then I'm also very much turning our perspective and our lens to the 2022 legislative session and beginning to think about what we can do there and what opportunities we have to advance this work forward. I think this is pretty much my last slide, but all in all, I just kind of want to reiterate that I think that Lifelong Colorado relies on our communities and our local governments really kind of being engaged with the state and being engaged with AARP and the folks who administer Boomer Bond at DrCOG to really move forward. But that's not to say that it is only the responsibility of local government and communities to plan and prepare for Colorado's aging population. And I know and we know at this state that we have an integral role to play in supporting community investments and advancing broader policy goals that support aging in the community. Again, I've said it earlier, but I'll say it again, this work is very much the logical continuation of the direction laid out by the Strategic Action Planning Group on Aging and the Colorado Commission on Aging that involve both state and local strategies. And as we transition out of the COVID-19 crisis, our communities will require intentional assessment and subsequent retooling in order to really rebuild stronger and more resilient. And I think that right now is the perfect opportunity to empower and mobilize local leaders in our communities through this Lifelong Colorado effort. So I will stop there. I appreciate the time and certainly willing and able to take discussion prompts and questions after Derek goes. But again, please feel free to register for my mailing list and feel free to reach out to me. If you have to email me twice, don't be afraid to do so. It's hard to keep up with everything. So thank you.
All right, thanks, Jarrett, and thanks everybody for the opportunity to come and talk to you today. My name is Derek Webb. I'm a planner by training, working at the Denver Regional Council of Governments. And I'm here specifically to talk to you about the Boomer Bond program. I will also get into a little bit of what we've seen in supporting communities as they work through the Boomer Bond assessment tool, some outcomes of that type of thing, and where we're headed next, or where we're hoping to head next with the tool itself. Next slide, please, Jarrett. But first, just want to give you a quick overview of DrCOG. Many of you may be familiar with DrCOG. There's many different facets to DrCOG, so I just wanted to highlight kind of how it all pieces together. DrCOG in general is a membership organization made up of the local governments throughout the Denver region. I think we're approaching almost 60 now. I think 58 to 59 current members throughout the Denver region. We respond to complex regional issues. These could be transportation issues. These could be aging related issues, land use planning issues, all those types of things. We collaborate to address unmet needs, trying to figure out how a region as a whole can work together to meet those needs. We plan for future needs, mainly in the spaces of aging, transportation planning, and land use coordination amongst and throughout the region. And we hope to improve the quality of life in the region. I think you can see in our logo, it says "We make life better." I think I don't think I speak for myself when I say that we hope we make life better for those in the region. Next slide, Jarrett. But we are also the area agency on aging. So I specifically work on the main DrCOG side of things. I technically work for the Metropolitan Planning Organization. But we also do house the area agency on aging, the largest division within DrCOG, which is there to help people age better. And you're probably familiar with area agency on aging's, or areas agency on aging, or however you should say that. But they provide information and services, fund community services, identify and fill gaps in services, and plan for future needs, and advocate on behalf of older adults and their caregivers. I would say if you were talking to Kelly Roberts, she would probably highlight 100 other things that her side of the shop at DrCOG does. But in general, they're to support and provide information and services and that type of thing for aging residents throughout the region. I would note that DrCOG also houses the Transportation Planning and Operations Division, which is really focused on kind of the funneling or the identification of transportation projects and federal funding for transportation projects throughout the region. And my shop specifically on the regional planning and development side of things focuses largely on kind of the overarching kind of vision for the region, and how the region can work together to solve land use issues, how land use and transportation coordinates, and that type of thing. But as a planner housed within the organization, I also am tasked and work with the area agency on aging to think through how communities can plan or better plan to support their aging residents. So next slide, please, Jarrett. Typically in my presentations about Boomer Bond, it's typically a pitch. It's a pitch about why you should maybe think about using an assessment tool or DrCOG's Boomer Bond assessment tool specifically. And at this point, or before I get to this slide, it's usually highlighting all of the reasons why we should be focused on the aging population. And it's typically a whole set of demographic slides about the trends that we're seeing in the aging population, how rapidly the aging population is growing, and all that kind of thing. But I felt like this presentation today is being given to a group of like-minded individuals. So I think you guys are already there and understand the needs and understand the reason why we need to focus on how to plan for better supporting our aging residents. So I'm just going to jump right into what the DrCOG Boomer Bond program and assessment tool and all that stuff is. If you have any questions or are interested in the demographic side of things, feel free to reach out to me directly. I'm happy to provide what that actually looks like, from the state to the region to even some local level type demographic information. So, but I'll jump in. Jared, if you want to go to the next slide. Just before I get into what the tool actually looks like, I wanted to provide a little bit of information about our motivation, and it really boils down to a need for a multi-pronged approach. Through the Area Agency on Aging, we have all of these ways to advocate for increasing funding, support and expand aging resources, identify and expand partnerships, increase awareness about the aging population and the needs of the aging population, all that type of stuff. But we really identified, and you see highlighted there, a need to engage local governments in the discussion as well, because as a regional agency, there's only so much we can bring to the table. And as Jared has really identified, it is kind of this top-down, bottom-up approach in tandem or in partnership to really affect change or positive change in the way that we support our older adults. Next slide, please, Jared. So Boomer Bond itself, there's two key elements. It's really a community assessment tool that's really set up to facilitate local dialogue and identify priorities. I'll dig a little deeper into that in just a minute. But it's also coupled with, or the idea is to couple it with, a comprehensive inventory to assist with future development of policies, plans, and strategies, that type of thing. So on the screen there, you see down on the left-hand side is the Boomer Bond assessment tool kind of graphic on the front cover. And then on the right is our resource directory, which is always available and kind of constantly evolving as new and innovative things pop up. But that resource directory is where you use the assessment tool itself to find gaps, opportunities, that type of thing. And then you could use the resource directory to find solutions to kind of deal with those issues that come up. So the resource directory itself contains things like model code, model ordinances, case studies, best practices, those types of things to potentially help communities address ways that they can better support their older adult population. Next slide, please, Jared. So why an assessment tool? Well, it's really set up to provide a means to start a conversation at the local level. And this isn't just with residents or just with local government staff. It's also including partners that are potentially supporting that local jurisdiction or local area or the region as a whole. It's really also set up to provide structure to what can be an overwhelming conversation. We've found that working through the assessment tool itself really provides kind of the rails on what the conversation should focus on and how to navigate those types of conversations. Because you can imagine getting into a conversation, a broad conversation about aging issues in your community could become pretty overwhelming very quickly. It's also set up to build on and improve staff to staff and staff to stakeholder relationships. It really is set up to help, as I mentioned, the conversation starter, but we found that the more people start talking about what they're doing and how what they do kind of addresses or has the potential to address some of the issues that we're seeing at the local level, this cross-pollination kind of happens where resources and support starts to get linked to better or more efficiently. Helps focus efforts to engage the public. So the assessment tool itself was developed as a kind of an internally focused local government assessment. So it's not the type of tool that you would use for a public meeting at the onset. Really, this tool is what local government staff would use division by division or as a group of division kind of heads to talk through how they currently support older adults in their community and where gaps lie, and then use that information to start a larger conversation with the public. And it's also to identify challenges and opportunities, which I've already mentioned. All right, next slide. Thanks, Jared. So Boomer Bond communities, right now you can see on the map kind of throughout the Denver region, we have 21 Boomer Bond communities in the cohort. I would add that about 6 years, I've been with DrCOG about 6 years. And at that time when I started and got tasked with this program, I think we completed about 8. And so in the last 6 years, we've definitely jumped quite a bit up to 21. And we had several in the pipeline that were gearing up and ready and interesting. We'd had some initial conversations about what process could look like for interested communities. And then obviously the pandemic hit, and that kind of shifted a lot of focus and a lot of resources and whatnot. So we are currently gearing up and ready when everything starts to feel a little safer to get back together, because ultimately the assessment process it's kind of a hard conversation to have through Zoom. It's a very intimate kind of conversation, and so we're ready and waiting. I know that the most recent 3 that have been working through the assessment process itself are City of Boulder, Castle Pines, and Edgewater. Edgewater just finished up and has kind of published their results and actually has implemented a few ideas. I know that City of Boulder has completed their assessment and are currently working through department level conversations and really trying to put together the pieces of what kind of next steps could look like. And Castle Pines, I know, was working on, they were specifically working on completing the assessment to provide an update for their comprehensive plan, a specific kind of aging section in their comp plan to kind of guide their future efforts. So very, very excited about the growth in the region and the link that this provides to Lifelong Colorado and kind of building that cohort of age-friendly communities throughout the state. Next slide, please, Jarrett. So what is the assessment tool? The assessment tool specifically consists of four different topic areas. You notice we don't have the 8 domains in here, but I would say that the 8 domains have kind of been collapsed or kind of combined into these 4 specific areas or topic areas. The process itself typically takes about 4 to 6 months to complete. Honestly, it often takes longer. And it largely depends on the size of the community. City of Boulder, City of Denver, those size of communities definitely take the 1 year plus mark. Whereas, I'm thinking of, let's see, like Frederick and Dacono, up in the northeast part of the Denver region. I think we completed this process in about 5 to 6 months. So it also consisted of 145 comprehensive questions that work through each of these 4 topic areas. It's not 145 comprehensive questions per, it's total. And oftentimes, folks will reach out and ask for the assessment tool, which I'm always happy to provide. So if you're interested in taking a look, please do reach out. I'm happy to share it with you. But I always respond with the caveat that the person requesting the tool itself shouldn't get overwhelmed, because when you start flipping through it, looks like a ton of information, a lot of work to do. But I think in many conversations, as we kind of think through and talk to an interested individual or community about using the tool, we can start to work through what the process could look like and kind of map out what the timeline looks like, and it starts to look and feel a little more approachable. So, Jarrett, next slide, please. So Boomer Bond results, and these are just some broad examples. I've got a couple slides after this one that talks about very specific outcomes or implementation strategies that came out of a community's assessment. But they are things like new accessory dwelling unit ordinance in a community with severe housing shortage. So this community specifically identified that their ability to support housing options for older adults throughout the stage of their aging within place, or aging within the community, and the need for potential ADUs to support that. The activation and increased effectiveness of local senior commissions. If you've ever polled or been involved in a senior commission, you know that they definitely differentiate in terms of their effectiveness and what they get tasked with, and how they support councils, city councils or town councils, and that type of thing. So sometimes out of an assessment comes the need to develop a plan or some sort of work program for a local senior commission. Other things like updated site plan review criteria. Let's see, I won't read all these, but the development of a community-based resource center or guide for older adults. That was definitely something that came out of the Edgewater assessment tool. They jumped right on it at the tail end of their assessment tool and updated their website and put together a very local, city of Edgewater specific resource guide. And then also reconsider previous decisions that were barriers to delivering the best service. So there was a community that we worked in a little while ago that completed the assessment, and throughout that process identified that they did have transit to support residents, older adult residents that were no longer interested or comfortable driving to get to things like the grocery store, the hair salon, what have you in the local jurisdiction, but there were rules on where they could go. So if someone was being picked up and right across the boundary into another jurisdiction was an easier jog to get to, say the grocery store, they may have to take that person all the way across town to get to a different grocery store, or a different bank, or something like that. So reconsidering those decisions and understanding the impact that they were having, although unintended, was something that definitely came out of an assessment process. Next slide, please, Jared. All right, so here's one local highlight. City of Sheridan. So a little while ago, we received a DOLA grant to help support some smaller community assessments. And City of Sheridan was one of those, one of the first ones that signed up, and we were able to help. But they recently applied for and received funding through a DrCOG program designed to support local planning and small infrastructure projects. It's called Safe Stops Through Sheridan. They're currently working through, I think they're out to bid for a contractor to actually do the work. But the Boomer Bond assessment process identified deficiencies at existing bus stops and transit stations, and they actually were able to kind of complete and put together a comprehensive inventory of the bus stop amenities that were needed. And they had also, during that process, noted some of the informal improvements made by transit patrons. So, this is definitely a situation that doesn't necessarily affect just older adults, but anybody in the community that may need to use that transit stop. So these were things like, just complete lack of a transit amenity, or in some cases somebody had put like a plastic lawn chair out there so somebody would have somewhere to sit, those types of things. But ultimately the project applied and was awarded funds to upgrade 32 of the 39 bus stops within the community with some with a much better transit amenity for folks throughout the community using transit. Next slide, please, Jared. So I also want to highlight that we are currently in the process of thinking through how to update the assessment tool itself. Next slide, Jared. Throughout, I would say at least the last, 8 to 10 assessments, we have definitely noticed some differing needs based on community size, who is at the table, who is actually participating in the process itself. And so listed here are just some of the observed needs for an updated tool. So sporadic or limited staff capacity and involvement, or the reliance on external stakeholders in some cases. As I mentioned at the beginning of my part of this presentation, the tool itself is really geared toward local government staff. So very specific questions about subject matter like zoning, like sidewalk widths, like policy and ordinances and that type of thing. And in some cases, some of the assessments have had to rely on external stakeholders and sometimes residents in order to get enough of a diverse voice in the room to really understand the needs of the community or the needs of the local jurisdiction to provide support, that the tool itself couldn't really obtain enough information the way it's currently written. I kind of just alluded to the second bullet point there, so I'll skip over that one just for time's sake. But you know, and then input gathered during discussion meetings versus the survey instrument itself. So in some cases, the survey instrument, we always talk about how much. So let me back up just for a second here. The assessment tool itself is really the assessment tool, and then the discussion that happens for each section of the tool. And the wealth of information about what's going on really comes out in the discussion. But what happens a lot of the time is that a lot of the answers to the assessment tool itself are don't know, or NA, or I'm not sure, or not my department, that kind of thing. And so what we found was that we were having to do this on the fly facilitation during the discussion meetings to really pull all that information out. So the assessment tool wasn't providing enough information to really dig deeper into the discussion meetings. It was really taking a lot of extra facilitation during those discussion meetings. So that was another observed need. And then Jarrett, just a minute ago or a couple minutes ago, mentioned the need for backbone organization. How can a backbone organization support assessment processes or this work throughout the state or in general? And in many cases throughout the use of the Boomer Bond tool, DrCOG has supported in helping manage that process. But how would a community do that without a backbone organization successfully managing an assessment? This isn't to say that every community needs handholding in this area, but some do quite a bit because it comes down to staff capacity. If staff is if their focus is constantly changing on different fires to put out, for lack of a better term, it's really hard to make this a priority to get managed and support a local jurisdiction to move through the assessment without somebody providing that backbone support. Next slide, please, Jared. And then kind of a confirmed, so I went from observed to the confirmed need for an updated tool, really among other things. We had a fantastic research assistant from CU Denver the last 2 years, and one of her first assignments was to kind of help provide a retrospective analysis of the experiences in communities that had previously completed the Boomer Bond program. So she managed to obtain feedback from interviews with 21 staff members from 17 of the 18 Boomer Bond communities. And really that conversation focused on the tool structure, the preparation for the assessment, the process, and post-assessment support. And she really came out of that with a lot of feedback and a lot of ideas on how DrCOG could think through updating the tool and updating the process in general. Next slide, please, Jared. So we have been working through kind of during COVID, since not a lot of communities had the capacity at the moment to take on the assessment itself. We took the time to kind of think through what a new workshop model would look like. And this is just some screenshots from some of the early planning phase of this. But really what it's boiled down to is this idea of a day one or day two or day and a half or one full day kind of workshop, in-person workshop, just to get everything out, kind of help participants get through all of the ideas, all of the issues that they foresee, and then start thinking through some ideas on how to address those issues. And it really relies on a lot of best practices that are already out there. So we whether it's mind mapping or empathy mapping or kind of really mapping out the problem space. It's set up in a way to try to get all of the information kind of completed in a 1 or 2 day workshop. But we're kind of stuck because we need to pilot it. We need to find a guinea pig, for lack of a better term, to really test it out and be willing to test it out with us and see where it goes and what tweaks need to be made to the new model to make it as effective as possible. Next slide, please, Jared. And that was it for me. I could go on for days about the tool and what we've seen and what we haven't seen, what we need, and all that kind of stuff. But for time's sake, I'll stop there. And I think, yep, I think we're at the right time for questions for all of us.
Thank you so much to our panelists. Wonderful insight. And the questions that are coming in are a result of your great presentation. So this is going to be a great dialogue. I want to remind everyone that if you have a question, go ahead and put it in the chat room. Some of you have been using that all throughout the session. So please continue to do that. And through the Q&A session, something may kind of spur an idea, or if you need someone to clarify a little bit more about what was discussed today. So, but before we get started with the questions, this is probably for Bob and Roberto. Can you provide us a few examples of some of the communities that have been involved in the age-friendly community work, and what have they achieved? Are there some concrete examples of some good work that's happening in those communities? Bob or Roberto?
Yeah, I'll start, Roberto. So
Okay.
I put up a list of the 19 communities that are members of the network. And certainly there are many concrete examples. The first one that comes to my mind is Carbondale, and indeed the Roaring Fork collaborative up there. Carbondale, Eagle County, and Pitkin County, who are all members of the community. They are working together on issues that were particularly highlighted during the pandemic, outreach to older adults about COVID, about how to get vaccines, and in particular outreach to the very populous Latino community in the Valley up there. So that's just one quick and I think important example that comes to mind.
Terrific. Does
And I would
Roberto
add-
have- There you
Yes,
go. There you are.
Yeah, there are commonalities among a lot of the communities. Somebody mentioned ADUs, and Colorado Springs, Denver, and Fort Collins have all either passed ADU ordinances, or in the case of Colorado Springs, Fort Collins are almost there. And this is something that helps both older homeowners that are trying to make more of their property, and increases flexibility for other community members that are looking for affordable housing. In the area of parks and trails, a lot of communities, again, pretty much every single one of them have worked on increasing walkability by better signage and trails, or even building new walking and biking trails. In the case of Larimer County, they've instituted a transportation information and coordination center that's geared towards helping residents in the more rural areas who are not cannot no longer drive, have access to what transportation services are there. So those are kind of commonalities, but pretty much every community does address what is the driving key issue in their community.
Great, thank you.
And Jody,
Yeah, go ahead,
I would
Jared.
jump in real quick and
course.
not necessarily offer specific examples within communities, but I think address one of the other questions that was in the chat that I think Kelly put in there around examples of really community-led efforts versus local government-led efforts. And I think that in its kind of purest form, I mean, I think a lot of the examples that Roberto highlighted in Larimer County, Colorado Springs, as well as Bob mentioning the Roaring Fork Valley area, those all started with community volunteers and folks at the ground level really kind of picking up these efforts and moving them to a level that their local governments acknowledged and bought into, and then influence kind of that outcome in policymaking and decision making. So I do think it kind of admitted during my presentation that it was going to be kind of state heavy and government heavy, and that's where I sit, right? So that's kind of gonna happen, but ultimately, it's communities and self-directed volunteer groups in Larimer County, I think, is an excellent example of that.
Terrific. Now, you all have touched on housing. Obviously, that is a very hot topic, big issue for our state. Seems like there's construction happening on every corner. Housing developments, condos, apartment blocks, but yet none of it really seems to be tailored for older Coloradans. Do any of you have insight about what kind of work is being done out there so that we can encourage housing that is actually older Coloradan appropriate?
Hey, Jody, I'd start by referring everybody to an article in today's Colorado Sun by Kevin Simpson that really directly addresses this issue, the difficulty of older adults finding a downsized housing product. It's a multifaceted problem and has to do with inventory that's not being built. It has to do with pricing, obviously, in the market. But it is a consistent problem, urban and rural, small town, county, big city, it's everywhere.
And Jody, I would add, I think there are a couple, well, I think this might get at a couple of the questions that were kind of indicated in the chat. You know, there are a few bills going through the state legislature right now that I think I'm sure are on many folks' radar, but you know, House Bill 1271, which would kind of direct the Department of Local Affairs and their Division of Housing to develop and really kind of coordinate closely with local governments on promoting the development of innovative affordable housing strategies. And then also, House Bill 1117, and I can put these in the chat as well, which really deals with the ability of a local government to promote and develop new housing units within kind of existing land use rules and barriers. And so I bring both those up. I think the House Bill 1117 very much has an ADU kind of focus to it, an accessory dwelling unit component. And then House Bill 1271 will really involve a lot of kind of rulemaking and developing of what those options look like on the back end. And I think at a kind of broader policy level, I think we, and I have been guilty of this very much in the past, but really kind of focusing more on the front end of policy and focusing on the development of legislation and getting it passed through the Senate and passed through the House and signed into law. But you know, the real work starts after that, right? I mean, that is where I think there's a lot of efficacy and opportunity to kind of apply this older adult lens to the rules and the implementation. You know, admittedly, it's hard on the front end of policy to do age-specific things. I will just kind of throw that out there. But when we look on the back end and opportunities to engage, I think there's a real opportunity there. And I think to some extent it's a missed opportunity. And I'm certainly, I know there's a lot of folks on this call that are very, very much familiar and you know, deeply ingrained in Colorado's policy world. So be interested in their perspectives on that as well. But I do think that kind of as an entire network of individuals that really do spend our time thinking about aging and older adults and the best way to kind of plan our communities and have policies that work for everyone, really. I mean, in Colorado for all, right? I mean, that's what we talk about a lot in the office. And so we have to make sure that we are actually doing that on the back end of policy.
Sure. And are there any opportunities right now for these two bills that are in session for advocacy by, you know, folks on this call today who might be really interested in kind of lending their voice? What do you recommend, or how can they get more involved with these bills?
Well, let me see. So 1117, I think, is on its way to the governor sometime soon.
Okay.
It's already passed through the House and the Senate.
Okay.
Has gone into kind of and then 1271 is currently in Senate appropriations. So you know, after Senate appropriations, it'll go to the floor and there'll be some work done there. So I mean, there is still time to, I mean, I think engage with the legislators that are on those bills specifically around it. But after the Division of Housing, the Department of Local Affairs will really be the group that's working on that bill on the back end, and that'll be happening over the summer. And so, it's certainly something that I'm very much intending on being involved in. And I think, there's a very community advocacy, and the voice of many of the folks on this call are very much heard and seen by the state government. And it's about persistence and kind of constantly kind of reaching out and almost pestering folks, right? I mean, that's kind of how it works.
So that, is even more important why for folks on the call today who are interested in this work to get on Jarrett's email list. So the Google form that he included in the chat room, encourage you so you can stay up to date and find out ways to get more involved. So, and then Bob Murphy, any way to get the link that we can put in the chat room to that article that appeared today in the Colorado Sun?
I did just put it in there.
Oh, thank you. Okay, you're one step ahead of me. That's perfect, because that's very, very timely. So thank you for doing that. So changing gears a little bit, just back to the governor's office and kind of taking a pulse check on just general interest in older adult issues. We know, Jarrett, you hold a very important office within the Capitol and working side by side with the governor. Are you seeing changes kind of more towards supporting older adult issues across the state? Is there a general shift just among our legislators? Or I know we all have a lot of work to still do, but is there any sort of momentum building under the dome?
I think so. I mean, I say that, I mean, I've been in this position. This week is actually 6 months. And so, it feels like a eternity, but it's also kind of gone by in the blink of an eye. And I think in this short amount of time, we really have been able to generate a great deal of support for this Lifelong Colorado work. And I think it really kind of has relied on kind of a consistent, logical pathway to move this work forward. And so I think, having the governor and lieutenant governor sign on to letters of support for this work, that doesn't mean it's done. And right, that's kind of the first step. So, we don't have, I don't have millions of dollars at my disposal at the moment to kind of work on and implement these efforts, but, very much kind of taking that one foot after the other. And unfortunately, I mean, things never happen as fast as we'd like them to, right? So it's about kind of small wins and building those up to have a foundation to build on moving forward. So I very much do think that we've been able to get a lot of progress just around this work and kind of building that momentum so we can actually move it forward. And I'm very open to kind of, I keep up very closely with Bob and Roberto around this work, and would certainly and be willing to kind of have them chime in and kind of offer their perspective.
Derek or Bob or Roberto? Anything to add to what Jarrett said?
Well, we with our communities, we are encouraging them to become more involved in advocacy, and there are a number of bills, as Jared mentioned before the legislature, that are going to impact the ability of communities to address issues that they face. One of them is related to the ability of communities to do inclusive zoning, where they can require developers to include affordable housing as part of developments, which is currently not a power that local communities have. And that is something that AARP is supporting, and we encourage our members to get involved in, because it gives communities greater flexibility in that area.
Thank you. Derek, this is geared toward you and the assessment tool. We have a question about who has completed that tool and maybe a little bit more insight of what they got, out feedback from that tool. So if you can take us just on a little bit of a deeper dive into the tool and some of the work that's being generated as a result.
Sure. That's a big question. The map I showed detailing the 21 communities that have currently taken or completed the assessment tool. I could run you through the list if you'd like. It's communities like the Town of Lyons, Idaho Springs, Frederick and Dacono. Frederick and Dacono actually did a combined assessment since they're basically right across the street from each other. City of Denver, City of Boulder, which I mentioned. The only county that completed the tool so far is Arapahoe County. Very involved with their senior services group and whatnot. Who else? Sheridan, whatnot. I did highlight a few during my portion of the presentation, but I think Roberto mentioned just a little bit ago that they all have similar needs and are seeing similar issues, and the degree to which they're feeling affected by them is definitely related to community size and resources and that type of thing. Housing obviously is a big issue, and just to point on that, I highlighted the fact that many times the adoption of an ADU ordinance comes up, or the implementation of an ADU ordinance comes up, and I think while that tends to be kind of the go-to, like, oh, this could work for the older adult population that have a lot of equity invested in their homes and whatnot in our communities. We rarely see this large uptick, when a ADU ordinance is adopted in folks running out and building ADUs on their property. Even though the ordinance may say that an ADU is now allowed, there are still a lot of hoops to jump through, and a lot of, I think, hesitation on the lending side on how to even build one. So we're not seeing a ton. I think the specific example I was highlighting in the presentation was the Town of Lyons. They were one of the first communities to work through. They were actually a pilot community for the Boomer Bond assessment tool. And one thing that came out of their assessment was that housing need and the thought that an AD ordinance would help. But I think even close to 10 years since their assessment, I think only a handful of ADUs have actually been built, and maybe not necessarily specifically to support an older adult resident. What else? It's also typically what comes out of an assessment process is this large list. Sometimes it could be upwards of 65 different types of recommendations, and when we're specifically involved, we really try to help communities prioritize that implementation strategy or recommendations list into kind of low-hanging fruit, things that could potentially be done low cost or no cost, all the way up to things that really need to be planned out and could take 5 to 10 years to actually implement. Some of the smaller things that something that came out of the Frederick and Dacono assessment was the general overlapping support between the two communities. So one thing there was just a Snow Buddies program. It turned out that Frederick actually had a program, but a lot of residents, basically across the highway in Dacono were requesting those services. And so just general coordination between the two communities at the staff level really helped increase the efficiency and effectiveness of that program between the two communities for all those residents. It could be things like website updates, actually creating just a very specific web page for older adults to easily navigate to find resources. Sometimes with good intentions, local governments will put that information on the website, but make it so difficult to find that older adults generally try to go to other resources. So making that more present is definitely something that comes out. I mean, it spreads the gamut of things that communities could do. I hope that gives some insight. I mean, I could go on and on.
Sure. And if folks need Derek to dive even deeper or give another type of example, just shoot your question into the chat room and we'll make sure that he addresses that.
To add on to
yeah, of course, Roberto, please.
Yes, One of the advantages of communities participating in both the Boomer Bond and Age-Friendly Network is that they get to learn from each other and share the best practices. The work on ADUs is a good example where there are a lot of barriers that are not obvious when you first start working on it. One of them is the issue of accessibility. A lot of ADUs really aren't that compliant with universal design principles. And one good example of an initiative to address this, which I think will have statewide implications, is in Fort Collins, where the group there is working with the university on the Lifelong Homes project. And they're specifically looking at the design changes that can be made to ADUs to bring them in greater compliance with universal design principles, which will then be popularized and applied throughout the state. I think the area of travel training is something where communities have learned from each other and have copied the model, where a lot of times older adults need a little building of a comfort zone in using available public transportation options to get from one city to the next. And a lot of communities have gotten involved in that.
Terrific. Before we go on to some more questions, I think Derek and Jarrett, you were going to do a poll, if I'm not mistaken. So now might be a good time to do that. And then we'll come back and wrap up with a few additional questions.
Sure, I can share my screen and bring that
Terrific.
up.
Thank you.
Let's see, where is it? There we go. So this is called Mentimeter. It's an online tool for engaging people virtually, but it's basically it's super easy if you're willing and able. You just have to go to menti.com. All the information is up at the top of the screen here. You go to menti.com and the only thing you see is a request for a code, and it asks you for this, what is that, 8-digit, 9-digit code up there. You put that code in and you should be able to answer the question. But what we're really looking for is just to kind of gauge who we're talking to today, see kind of the spread throughout the state. This is just there's only 4 questions. Should be pretty quick. If you have any issues, feel free to type it into the chat box. I would assume we can help you through that too. The larger the word, the more people there. I think we've got upwards of 50 folks joining us, so we'll give it a few more minutes or another minute. I'm also seeing in the chat Frederick, Greeley, Colorado Springs, and Castle Rock. So. Should we move on? Should we give it a minute? All right, we can go to the next one. I can figure out how. All right. All right, so just a general question about, if your community has completed an assessment. So has your community completed an assessment and or developed a plan to better support older adults? This will kind of show the distribution of the group.
Do you want these answers in chat?
Now, do you see at the top of the screen, there's this www.menti.com. Can you see that?
Okay, thanks.
Yep. If you go there and enter the code that's there, it'll let you throw your answer out there. All right. Looks like we've stalled out, so we'll go to the next question. So this question is about which domain of livability is most important to you. So I've listed them all here. As folks answer, it should kind of populate. And this is asking for the single most important. I think we all understand that one is probably not. Look at that, everybody is interested in housing. Give it another minute here. All right, and I think we just have one more question. This should be a, you can type in whatever you'd like here. It'll let you type 3. So what top 3 needs do you see in your community? I would expect to see a lot of housing in this one, but there could be some others that come to light as well. There we go.
Derek, I just wanted to complain about your survey because it cuts you off at about 10 characters, so I couldn't put control of outside investing, which is ruining Colorado Springs. When we have homes for sale and they're bought by people in California and China, it does not help local housing.
Sure. Well, apologies about the character count, but thank you. Thanks for jumping in. Looks like that's probably it. Well, thank you guys for working through the survey with us. I just wanted to kind of get a pulse on your thoughts on this, and kind of helps us think through, as we work through Lifelong Colorado and individually in our organizations, what we can definitely focus our efforts on. So thank you.
And housing was right there with transportation, #1, so it didn't disappoint. All right, a question from Kelly actually is about having key stakeholders and folks who are involved in this work collaborating, and how do they continue to do that? And so thank you, Bob Murphy, for putting in there a little bit about the conference that is hosted, as well as the brand new portal. I'm not sure that everyone has seen that, Bob. So do you mind just explaining that platform that you have for that exchange of ideas through AARP?
Yes, certainly. Thanks, Jody. It's a brand new platform, actually just a few weeks old, and it's an opportunity for, it's like a giant chat room, okay? It's an opportunity for members of our age-friendly network, including policymakers and stakeholders, to go in, engage in conversations, share best practices, research what's being done in other parts of the state or indeed all around the country. And it's something we are really just trying to ramp up and encourage people to get involved with, because we can only do so many statewide conferences a year, and in some way, shape, or form, we've probably done a half a dozen in the last year and have 2 or 3 more planned for this year. But this enables folks to engage every single day.
And Derek, anything on the Boomer Bomb side that encourages this collaboration and sharing of ideas?
Yeah, so we're specifically thinking through ways to kind of engage, stay connected with the Boomer Bond cohort, or the Boomer Bond communities that are growing in the list, and just trying to share best practices and stuff, but also trying to understand that they're all tapped and staff capacity is definitely an issue. And so how often do we engage them? How often do we try to survey them to try to figure out what they're up to, what stuff they've implemented, if they're still thinking about Boomer Bond and all of the, that massive list I talked about that they came up with of things to do. And so while it's been kind of hit or miss, we do have it in our work plan for the upcoming year to think through how to specifically engage. So nothing really formal at this point, but there is a community kind of discussion, informal community discussion right now. So
terrific. Phil has an interesting question. Back to you, Derek. Has the state itself, so the administration and legislators, completed the Boomer Bond assessment?
Not that I'm aware of. That would be
Derek needs to get on that.
That would be a heavy lift.
Wouldn't it?
Yeah, but I think to that point, Phil, I think that's very much the direction that we're trying to take with the Department of Local Affairs, and comprehensive planning that they are, municipalities and counties are required to do, is very much kind of integrating those pieces into the existing structures that we have. So that is, everything takes additional resources, right? So it can't just be something that you add on without funding or human capital and human resources. So that is very much a goal. And then I think, the reality is the last 2 years, we've been significantly hampered in what we could spend money on statewide. So, next year, I think we're kind of stepping out of that. And then hopefully moving forward, we are in a bit of a place where we can really just kind of spend more money. But in the grand scheme of things, the legislature is always going to be able to have a little bit more of that kind of flexible funding, I think, kind of on the, the governor's budget will be introduced in November, and then there's always pots of money set aside for the legislature to work with. Obviously, last year was not one of those years, and we had to cut about $2 billion out of the budget. But yeah, long term, very much looking to integrate these types of assessments into what cities and counties already do.
Terrific. And Phil, also just another question from him is about the legislators diverting funds away from housing and affordable housing a few years ago. what is happening at local levels? And he gives the example of the Aging Well Resource Center in Littleton. Any news or updates about any of that work from any of our panelists? That's kind of open to all of you.
I can kind of jump in.
Okay, thanks, Sarah.
Very familiar with the Aging Well Resource Center. It's definitely a model that we promote when we're working through the Boomer Bond, when that type of situation arises or that type of recommendation arises. I would say often when it comes to affordable housing or housing in general, it's often in the discussion of how to strengthen the local jurisdiction's relationship with a housing authority, and how to support the housing authority, but also try to influence housing authority efforts on affordable housing in the older adult or senior housing space. I haven't specifically seen anything productive or any development come out of that type of conversation, but that's kind of been what across the board those types of conversations have alluded to.
Terrific. And in the chat for our panelists are some other suggestions of just areas to focus. So before you all leave us today, make sure you just kind of spin through that chat room a little bit, because there's been some great discussion just around Medicaid and some of the other topics that we can't get to today in this particular forum. But I think as leaders, certainly across our state, it's good for you to know some of the feedback that is coming in as well. Also, for all of our attendees, please do take a quick peek at the chat room. There's a number of resources that we've talked about through today's discussion that have been posted there. So make sure you hop on those links before you log off today. Also included in the chat room is an evaluation for today's session. It literally takes less than 30 seconds. I think it's 4 or 5 questions at most. So before you jump off, if you can fill that out for us, that's a huge help in directing us for future programming and what it is that you want to hear, see, and learn, and particular leaders across the state that you'd like to hear from. So if you don't mind taking a quick minute to visit that link as well, that is there. And then finally, a reminder, Older Coloradans Month webinars, and next week on May 26th, so same day, same time, next Wednesday from 1 to 3 p.m. And this will be a great way to kind of end our seminar, our webinar series, because we're actually going to have representatives from different parts of the state who can really take a deep dive into what's happening regionally in their areas. What is working? I know there were a number of questions today about provide examples of communities where this is working and what is working. And so our panelists provided a few examples for us today, but we will have leaders that represent different parts of the state taking us kind of on a tour of what has worked and what hasn't, and what do we still need to address, certainly in those areas, as well as just a state ensuring that this is a great place to age well. So those are the resources that are in the chat room. The link to register, if you haven't already, for next week's session is also there and can be found in addition on the Colorado Senior Lobby website. So if there are no further questions, it doesn't look like any more have come into the chat room. A huge thank you, big thank you for our panelists today, taking time out of your very busy schedules to share with us your insight, your perspectives, your expertise on how we can continue this momentum of building age-friendly communities. So thank you very much. And at this time, I'd like to hand it back to Bob Brocker, President of Colorado Senior Lobby.
Thank you, Jody. And Katie Bishop, if you're still on, do you want to talk just briefly about what's been going on in the background here with Relay Colorado as we've spent the last hour and 45 minutes or so? Are you there, Katie?
Yes,
Oh.
hi. Yeah, we are continuing to do as much outreach as we can statewide. So each state has a Relay Colorado set a relay system set up, but we focus specifically on Colorado and making sure that individuals who are aging and have a hearing loss and or people who are deaf and hard of hearing are able to stay connected through phone access. So we are trying to do our best to be as far reaching as we can in all corners of the state. We are trying to focus on remote areas and get our information out as much as we are able to. We are honored to be able to connect with different organizations, such as many of you who are here. So I can put my email in the chat box as well. If anybody has any questions or needs to contact me, we would love to be able to share more about the webinars that we have. And you can go to relaycolorado.com/webinars to be able to access and register. Those are at no cost to individuals who attend them. And we also are able to, hopefully now that doors are kind of opening, we will be able to get back out in the community and share our information and how we can best service individuals and what their needs are, whether that be the CapTel phone, the relay conference captioning, and we also have a speech-to-speech service, as well as our 711 Connect. So we have a lot of different resources out there that we would love to share when given the opportunity.
Okay, thank you, Katie.
Sure.
So just to wrap up here real quick, it's been very encouraging to see all of the activity that's been going on across the state with these many different communities, with Boomer Bond, with Lifelong Colorado, all the work that AARP has been doing and DrCOG has been doing. I know that there have been some significant changes made. And every community focuses on different issues. So, and that's actually a good thing because it gives everybody an opportunity to learn from one another. So I would like to close with a quick reminder to remember that as our 50 plus population is growing, the average age of our legislature is growing younger. So with a few very notable exceptions, they are not naturally drawn to think about the issues of aging. So that's our job. It's our duty, really, to keep the issues in front of them, to bring ideas for solutions and to advocate for those ideas. And then as Jarrett said very early on, the real work actually begins after the legislation is passed and when it gets into the different agencies. And that's an opportunity to influence how that particular legislation is actually implemented. And implementation really is everything. So please do tune in next week. We'd love to see you again. Thank you again for joining us today. Thanks again to all of our panelists and moderators. And we'll close out just a little bit early. I'm sure that won't bother anyone. So, all right, have a great day. Thank you very much.